Okay, let's dive into something really quite inspiring today. The big question is, how can technology make healthcare accessible for, well, everyone, no matter where they happen to be?
Exactly. That's the core issue we're exploring based on the sources we have. We're focusing on one particular project.
Right. So our mission for this deep dive is really to unpack the story behind something called Dr. Medibud. We want to look at the founders, their driving mission, and the healthcare problem they're trying to tackle.
And this is where it gets really interesting, I think. The founders, you're not going to believe this. They're two brothers, Junior, who's 12, and Jameson, his younger brother, who's only 10.
10 and 12, it's pretty amazing, isn't it? Taking on such a huge challenge at that age.
It's genuinely fascinating. And the sources say the whole thing didn't start with some, master plan. It actually began just talking at the dinner table.
Just a normal conversation.
Yeah, but apparently they were just chatting and wondering, why do people have to wait so long or, travel such long distances just to see a doctor? Simple question, right?
But it led to something much bigger. That curiosity made them listen to stories. Stories about families, maybe in rural areas, having to travel a whole day
A whole day.
just to get to a hospital,
Yeah.
or people who just couldn't afford a basic checkup. And maybe saddest of all, people who didn't know their symptoms were serious until it was almost too late.
hmm And the sources really emphasize how hearing this stuff,
Hmm.
it just struck them as fundamentally unfair.
Right. That feeling of unfairness wasn't just like, oh, that's sad. It actually pushed them to do something.
Exactly. They didn't just sit there feeling bad. They started building things, learning everything they could find, asking some pretty tough questions. Their goal became, pretty ambitious. Create something small, maybe, but something that could make a real difference.
So, something small. What did they picture? What was the idea?
They wanted to build a tool, basically something that could listen, almost like a doctor does, ask relevant questions about what's wrong,
Yeah.
and then help guide people towards getting the right care.
Hmm.
Even if, getting to a clinic was difficult or affording it was an issue.
And that led to Dr. Medibud.
That's it. Dr. Medibud. It's an AI-powered health assistant.
Hmm.
And its core mission, reading straight from the sources, is simple and powerful. Make trusted health advice available to anyone, anywhere.
Anyone, anywhere. That's quite a goal.
It is. The bigger vision uses AI to make healthcare more accessible, yes, but also more intelligent and, importantly, more human-centered. Using AI for things like early diagnosis help, health education, and patient support, but doing it at scale.
But okay, how did two kids, 10 and 12, actually build something like this? I mean, that's the incredible part.
Well, the sources describe this amazing learning journey they went on. They had to teach themselves about AI, about how medical knowledge is structured,
Hmm.
almost like building a huge digital library or a knowledge tree for the AI to understand medicine.
Wow.
And it wasn't just about the technical stuff, the data. They thought really carefully about Dr. Medibud's personality, too.
It's personality, an AI personality.
Yeah, they designed it to be smart, obviously,
Yeah.
but also really kind and calm.
Mm.
They understood how important that sort of, bedside manner is, even for an AI, especially when someone's feeling anxious about their health.
That's a really key point from the sources, isn't it? Trust isn't just about being right, it's about the interaction.
Absolutely. So they trained it very carefully to ask the right kinds of symptom-checking questions. And maybe the most crucial part, they built in the intelligence for it to know its limits, to know when to say very clearly, okay, you really need to see a human doctor now.
That's vital. So it's not trying to replace doctors entirely.
Not at all. And to make it work, the sources say they use some pretty advanced AI techniques. Things like large language models, the tech behind a lot of chatbots.
Mm-hmm.
But combined with something called retrieval augmented generation, or RAY,
Yeah.
that basically means the AI doesn't just, make stuff up. It's trained to pull specific, reliable information from trusted medical sources they fed into it.
Ah, okay. So it grounds the advice in actual medical knowledge that builds trust.
Exactly. And all this hard work, this innovation, it got noticed.
Mhm.
Big time. In 2024, Dr. Medibud won the Microsoft Imagine Cup Junior Award, global recognition.
Fantastic.
Yeah, but they didn't just, take the award and stop. They're actively working now to turn this whole concept into a real thing people can use.
So they're launching it.
They are. Launching Dr. Medibud as a free AI-powered health assistant. The idea is it should be available wherever you are, busy city, remote village, or even if you're just at home, feeling a bit unsure about a symptom and want some initial guidance.
There's a phrase from the sources, a kind of hook statement that really captures it. They called it an AI healthcare assistant created by two brothers aiming to be What was it? Your AI doctor for everyday peace of mind.
Yeah, everyday peace of mind. I like that. It really speaks to this idea of democratizing healthcare access, doesn't it? Making a personalized sort of lifelong AI health guide potentially available to anyone.
Just think about that for a second. What that could mean for you, or maybe someone you know, having access to a tool like that no matter where they live or what their situation is.
The potential impact is huge.
It really is. And, when you consider the passion, the drive, the sheer technical skill these two young brothers have shown, it just makes you wonder, doesn't it?
What else is possible?
Yeah. What other massive global challenges could young people tackle using technology if they just had the chance, the tools, the encouragement? This feels like just the start for them and maybe for many others too. What problems could you imagine tackling?